Columbus.
Good morning and thank you. I have no disclosures. Laparoscopic Nissen fundoplication is a surgical gold standard for gastroesophageal reflux disease. There's been an increasing patient demand for less invasive procedures, and this has been coupled with advances in endoluminal therapies. And this has led to the evaluation of safe and effective endoluminal therapies for gastroesophageal reflux disease. Esophax is a novel FDA-approved endoluminal device for treatment of gastroesophageal reflux disease. It deploys full-thickness polypropylene fasteners to mechanically recreate the gastroesophageal junction valve. The largest experience has been in Europe. Kadir published a multi-center study of 86 patients who underwent esophax. There were 2 esophageal perforations and 1 post-procedure bleed. At 12 months follow-up, 67% of patients did not use any PPI medication, and there was significant improvement in GERD health-related quality of life in 73% of patients. 3 patients in this group underwent a Nissen fundoplication, 2 of them for the aforementioned perforations, and 1 for treatment failure. This is a single institution prospective study of all patients undergoing esophax between September of 2007 and March of 2009. Their primary outcomes were safety and efficacy, and efficacy was assessed by symptom severity scores using the Anvari score and health-related quality of life using the Vonovich score, as well as an evaluation of PPI usage. Patients were placed in the operating room under general anesthesia, under nasotracheal intubation, and in the left lateral decubitus position. Can we click on the slide, please? On the actual box? Okay.
Are you having a problem with the video over there? Guess we'll have to take your word for it.
I'm not sure what's happening. I was working in the prep center. I guess I'll move on. The video just showed quickly how it works. Basically, the device is inserted via the mouth, esophagus into the stomach, and the device is articulated. A helical retractor is used to bring out gastric tissue into the mold of the device. A stylet is then firing the polypropylene fastener and resulting in a full thickness deployment of the device. And this is repeated to perform a 200 to 300 degree fundoplication over 2 to 3 centimeters. Patients are admitted overnight and discharged the following day and are followed up in clinic. So we had 26 patients, the mean age of 45, and 62% were female. The mean BMI was 28. The mean time was 65 minutes. The length of stay was 1 day with a range of 0 to 6 days. We had 2 complications consisting of 2 post-procedure bleeds that required endoscopy and transfusion. Many patients also complained of a sore throat and left shoulder pain, and this was usually self-limited and resolved within the first week. We had 1 late death from a drug overdose unrelated to the procedure. We had 3 failures, all undergoing Nissen fundoplication. 2 of them were early failures with postoperative vomiting and dislodgement of the fasteners. And follow-up was complete in 81% of patients. This graph demonstrates health-related quality of life and Anvari scores pre- and post-operatively. And as you can see, the mean scores were significantly decreased, which is improved post-operatively. This graph just demonstrates individual scores for pre- and post-procedure Vonovich scores. And there was a 50% improvement in health-related in Vonovich scores. This demonstrates the Anvari scores individually, and there was a 60% greater than 50% improvement in Anvari scores. Finally, this graph demonstrates if 100% of patients were on full dose medications pre-procedure, post-procedure 35% were off meds completely, 24% were on a half dose, but 41% were still on their preoperative dose of medication. In summary then, our early experience with esophax in this unselected patient population referred for surgical therapy has been shown to you. We had 2 major complications consisting of bleeding requiring endoscopy and transfusion, length of stay 3 days and 6 days. We had 3 early failures requiring Nissen fundoplication. We had improved mean health-related quality of life and symptom severity scores, and 59% of patients were improved. 35% were off meds, and 24% had a half dose. In conclusion then, ladies and gentlemen, further study is needed, including objective measurements using pH studies and repeat scopes to better assess esophagus. Larger experience with this device will help identify a specific patient population most likely to benefit from esophagus. Thank you very much.